Good afternoon, everyone. Thanks for joining us on the media briefing for this Wednesday. We are very pleased to have Dr. Moreno, our County Public Health Officer, on the line today to give us an update and also answer questions that you might have. Good afternoon, Dr. Moreno.
Yeah, hi, Mia. Good afternoon. All right. Good afternoon, everyone. Ed Moreno, Monterey County Health Officer, Director of Public Health. And I think my update will be brief. We are, for several weeks, we were looking at stable, low case rates here in Monterey County and much of California. But in recent weeks, State Department of Public Health is reporting that there's an increase statewide in the case rate and hospitalizations due to COVID. And we're certainly seeing that here in Monterey County as well. The overall case rate is now up to 3.1 per 100,000, which means that that's about on average every day, it's about 15 new cases a day. And we were down to below 5 cases a day in previous months. So definitely seeing an increase in case rates consistent with what's going on throughout California. Our positivity rate has also gone up to 2.4, and that was 2.4%, which meant that for every 100 people that got vaccinated, 2 to 3 people are testing positive. And when we had the lower case rates, our positivity rate, which is a reflection of transmission, was also pretty low. It was less than one person per 100. For every 100 people tested, less than one person was testing positive. So that's on the rise as well. But in addition to that, we're also seeing an increase in hospitalizations. So when we've had about a handful of people hospitalized in most of May and June, we are seeing now about 11, on average, about 11 people hospitalized in our 4 hospitals due to COVID-19. We're fortunate in that we really haven't seen an increase in fatalities, and so we're fortunate that we haven't seen that. This, I believe, is primarily due to 3 things. One is that the state on June 15th released the restrictions on businesses, and that allows for more people to have more opportunities to engage with people that aren't from their households. And so that could be contributing to increased risk of exposure outside of their homes. In addition, we still have about 30% of the population that has not received a vaccine here in Monterey County. So we still have a fair amount of people who may be susceptible to COVID because they don't have any antibodies or immune response yet to the virus or the vaccine. And finally, due to the Delta virus. The Delta virus accounts for somewhere between 40 to 50%, an estimated 40 to 50% of those specimens that are sequenced statewide. Here in Monterey County, we have a small number of cases that are sequenced, but of the numbers that we have seen sequenced among Monterey County residents, it looks like we're somewhere also between 40 to 50% of those sequenced specimens turning out to be due to the Delta variant. The Delta variant is more contagious than the previous variants and definitely more contagious than the original virus that causes COVID-19. So we know also a little bit about the people who are getting hospitalized, and information that's being shared by the hospitals is that nearly all individuals who were admitted recently with COVID-19 to the hospitals were unvaccinated. So it appears that individuals who are unvaccinated are at greater risk of coming down with COVID at this time and are more likely to be hospitalized compared to people who were vaccinated and came down with COVID. So this provides further, this further supports the CDC's and CDPH's statements that the COVID vaccine is providing protection. In this case, particularly with the Delta strain, it's providing those who are vaccinated protection against hospitalization. And that's really what we're trying to do, prevent severe illness during this pandemic and spare our hospitals the risk of being overwhelmed by large numbers of people being hospitalized due to COVID-19. Given the fact that we do have increased case rates, we have increased spread, we have increase in hospitalizations, and we are seeing some people who were previously vaccinated who got COVID-19. There's still some uncertainty as to where this is headed, how high will the case rate go, how many people will be hospitalized. So again, we need to learn. The CDC and the state need to learn more about this Delta variant, and in the meantime, it appears that more people are getting infected with it. So Monterey County and some of our partnering counties here in the Monterey Bay and Bay Area did issue on Monday additional guidance to the general public, and that it still aligns with California Department of Public Health's guidance. That guidance states that individuals in California who are unvaccinated need to continue to wear face coverings when they're indoor in public settings, and those who are unvaccinated don't need to wear the face coverings when they're indoors. However, because of the increase in case rates and increased hospitalizations, our recommendation is that individuals who have already been vaccinated can continue to wear face coverings indoors when they're out in public because of the increase in spread of COVID-19 in Monterey County and in California. So we issued that on Monday as a recommendation, not as a requirement, and we are still aligned with California Department of Public Health. Let's see, as far as the variants, we are still waiting for reports for an update. So at this time, nothing has changed. We still have 14 cases that we know of that are due to the Delta variant here in Monterey County. But here and in the state, it is approximately 40 to 50% of the COVID cases that have been sequenced. But we will continue to run genomic sequencing here in our laboratory, and we will also, we know that other individuals who are positive have had their specimens taken, submitted for genomic sequencing in other laboratories outside of our public health laboratory. So we continue to look for reports on COVID genomic sequencing that are being done in other laboratories so that we have a summary of COVID variant sequencing to share with the public locally. Let's see, and I think that's about it, Maya, and I can take questions if there are any.
Thank you very much, Dr. Moreno. And so this is a good time for everyone to start submitting your questions via chat. And for the people who are watching us on YouTube and Facebook, I'll go ahead and read the questions so Dr. Moreno can respond. So Dr. Moreno, here's a question for you. You are urging private businesses to require customers wear masks inside. I'm going to break this up. There's a lot of questions in this one, so I'm going to break this up. Are all employees and visitors of the county health department currently required to wear a mask inside the building, regardless of vaccination status?
The guidance that the county issued is a recommendation. It's just recommending that people who are unvaccinated to continue wearing face coverings in indoor settings. It's just a recommendation. It's not a requirement that any employers have to take action.
Okay, and then regarding our county buildings, our county buildings do not require masks inside the building if you are vaccinated, correct?
That one, it's a question about the county as an employer, so we'd have to refer that to Human Resources.
Right. And so here's the rest of that question.
Mm-hmm.
Are you urging Monterey County to adopt universal indoor masking requirements at other government buildings and offices?
The guidance that was released was for the general public primarily. And again, it's a recommendation, not a requirement for people to decide for themselves when they're in indoor setting in public, indoors in public settings, even if they're vaccinated, to consider wearing a face covering until we learn more about what's happening with this increase in cases. primarily due to Delta.
All right. Thanks very much. And here's another question for you. How many Delta cases in total are there in Monterey County?
How many? Please ask the question again.
Sorry, how many Delta Delta variant cases do we have in Monterey County?
Okay, excellent question. We are aware of 14 Delta cases here in Monterey County. I'd like to point out that not all specimens from people who are diagnosed with COVID-19 are sequenced. Only a portion of those are sequenced. So we have a small amount that are made available to us. Often they're from the hospitals, and they send us specimens that from someone who tested positive. And when they send us those specimens, we can run sequencing. But if they don't submit the specimens to us, we can't perform the sequencing. And so we just know of the results for those that have been sequenced. So we have 14 at this time, and hopefully this week we'll have an update as to whether or not we have more.
Thank you very much. Here's a follow-up question from the first question we asked. The reporter is referencing the press release that we sent out Monday, which said even for the fully vaccinated, the health department is urging business owners to require customers to wear masks when inside their businesses. And then it follows on to say that the counties are recommending everyone wear a mask indoors. I think that was where the inquiry about requiring businesses.
Yeah, again, it's a recommendation, not a requirement. And anything we can do to decrease the spread of COVID-19 at this time, especially with the Delta variant, is going to be hopefully effective at preventing another surge here.
Thank you. Another question, is there any talk or discussion about going to mandatory mask requirements similar to what Los Angeles County is doing?
So excellent question. Yes, there are some counties like LA County who are requiring face coverings, which go beyond what California Department of Public Health is requiring. So at this time, we're still very much looking to align ourselves with California Department of Public Health, which is why the guidance that we released on Monday is just a recommendation. It still allows individuals who are vaccinated to remove their mask indoors if they choose to do so. And it still allows employers to choose one of several options to comply with CalOSHA and face covering requirements in the work site.
Thank you. We talked just briefly about hospitalizations increasing. Do you have the current number of people hospitalized with COVID available to you right now? Because I can certainly refer to the website.
Yes, I would refer to the website for the most recent. I have from yesterday an update I provided, 11, but that may have changed when our staff updated the website as the number of hospitalizations.
And in fact, I've got a question for you. And while you're answering that, I can go and check our website because I think those numbers are posted. So here's another question. Which metric, positive tests, number of cases, variant cases, hospitalizations, or deaths, did you consider when you decided to reinstitute mask recommendations? And then which of those metrics is the most important in deciding if the county is in a surge?
So there's a variety of considerations. We have our local metrics, and they all have an important role to play in trying to assess what is happening with COVID-19 at this point in the pandemic. So those metrics all play a role in deciding. And then in addition to that, we also look at the broader context. So Monterey County is not isolated. We're part of a region, and that region is part of California. And so looking at what's happening statewide and what's happening to our neighboring counties, we know that the increase is not is consistent. Is consistent with what's happening in other counties and across the state. So we also look at information, data, case rates, hospitalizations, variants, emergence throughout the state. And finally, there's also a much bigger context, which is the state of California in the context of the rest of the nation. And we know that we have a lot of individuals, other states who have much lower vaccination rates than California has and much lower than Monterey County. And they're seeing much higher case rates. Their hospitals are filling up. And in that context, we in California know that California is a place where people visit for vacationing, for meetings, for conferences. And so there's also we also have a concern that there may be people coming in from parts of other regions, nationally and globally, that may be bringing increased risk of exposure here locally to COVID-19. So there are a lot of layers of data to consider on both the local, state, and national level, and using all that. I and other health officers in the Monterey Bay and Bay Area decided that we really need to alert the public and let the public know what measures they can take voluntarily to protect themselves and prevent further spread of COVID-19.
Thank you, Dr. Moreno. And then for those who were asking about the number of hospitalization, today's data shows 14 cases currently hospitalized, which is an increase of 2 from yesterday. Are there any other questions for Dr. Moreno today? And here's a question for you, Dr. Moreno. Would you say that Monterey County is in a surge right now?
Very, very good question. And I think that reflects concern about the increase in cases. At this point, the California Department of Public Health, I don't believe, has declared a surge or said that we're in a surge situation here. They have shared with us that they're monitoring it closely and that, but they have not said that we're in a surge. What I can say is that, again, is that we have an increase in cases. We have when I look at what I haven't shared is when we look at the data, and it looks like the increase is not a straight slope. It's curving up, which is what we saw with the first wave, the first and the second wave. And when that happens, that reflects increasing transmission. So again, I have concern, and I just want to make sure that people in Monterey County are aware of the increased hospitalizations, and are aware of measures they can take, like wearing face coverings, even if they're vaccinated, to protect themselves and prevent further spread of COVID-19.
Thank you, Dr. Moreno. Are there any other questions? Some are coming in. Dr. Moreno, are you disappointed in the 47% county vaccination rate for those 12 to 17?
So we're making progress in that group. Every week, we make a 1 or 2% increase in that group. So we are making progress, which is good. We also know that that group was the last group to become eligible to receive the vaccine. And so it's going to take a while for them to catch up to the other age groups in terms of the percent that are vaccinated. I'd also just like to say that in my meetings with healthcare providers, primarily primary care physicians and clinicians, I continue to thank them for the work that they've done to help get people vaccinated. And for those that are caring for pediatric patients, urging them to have those discussions with the parents of the kids who are eligible about the benefits of getting their kids vaccinated. Surveys have shown that people who are undecided about whether or not they're going to get the vaccine rank their healthcare provider as one source that they would listen to and would consider getting the vaccine if their primary care provider recommended it. So for that age group, I think it's really important for the pediatric providers to have those conversations with the parents of the kids, and hopefully parents will agree to have their kids vaccinated, and hopefully they'll get fully vaccinated before we start the next school year.
Thank you, Dr. Moreno. Any other questions for Dr. Moreno today? Seeing none, that will wrap up our briefing for today. Thanks, everyone, for joining in on the call. Our next briefing is next Wednesday. We'll see you then. Good
Thanks, Mary.
afternoon, everyone.